Hi, I'm Rachel Wall, founder of InspiredHygiene.com. And I have been with a couple teams recently and I've heard some specific language come up. I wanted to share this with you to see if you've ever heard this. We can't recommend that treatment to our patients because they don't have insurance. Or we can't recommend that treatment to a patient because their insurance doesn't cover it. So all of a sudden what's happening is whether or not that patient has insurance, either way, depends on the situation, either way that patient's insurance status is determining what treatment is being recommended in these cases. Now I know that none of us would ever say or want to believe that we let insurance dictate the treatment that we recommend, but in reality it happens all the time. And it's something that we all have to fight. We all have to fight that tendency to restrict what we recommend to patients based on what we feel like their ability is to pay or their ability to have insurance contribution. So instead of saying this patient can't have that treatment, I want you to look at three things in order to really analyze this and to really evaluate where you stand in your practice with this. So the first thing, if you find yourself saying things like that, the first thing you want to evaluate is your mindset, right? So what do we believe about the treatment that we're recommending? Do we believe that the value of the treatment that we're recommending far outweighs the cost? You know, there's a study recently that showed the impact, the financial impact that periotherapy had with patients with diabetes, with patients with cardiovascular disease, with pregnant patients. What was the average financial impact that it made in reducing their medical costs when patients like this had periotherapy, for example? But it doesn't matter what the treatment is, right? We must believe that the value of the treatment far outweighs the cost, okay? The second thing that you want to evaluate is your language. Right, what language are we using around each other, our team, and what language are we using with our patients? Are we saying, well, you could have this treatment, but you won't get any benefit, and then all of a sudden it's off the table, right? Instead of recommending ideal treatment to our patients and letting them make the decision, okay? And then that brings us to the third thing that you'll want to evaluate is options. What type of treatment options do you offer to your patients? What type of financial options do you offer to your patients? Do you make decisions about the options based on the type of patient that they are? Or do you offer everybody the same options? And do you have a range of options from, let's say, an option where they get a benefit if they pay in full? Or perhaps you have a care credit option, right, where they can spread it out over time, or they can do a short-term interest-free. Do you have a short-term in-office option, right, where they don't have to have a credit check? Do you have a savings plan, maybe for those patients that don't have insurance, where they can save some if they participate in the savings plan that you offer through your practice? Really, really important to have all these three things aligned so that you can say, you know what, this patient can have this treatment. Let's figure out a way to help them work it out. Thank you. We'll see you next time.